So NACHO affiliates. So like I said, AMSANT is the Aboriginal peak body for the Northern Territory. There is one in every state and territory. So wherever you go, there is a peak body within that state or territory. NACHO is the national body. They deal with a number of things at a national level. Within my position, there is a workforce coordinator that looks after the workforce components and coordinates each and every position of mine across the states and territories so that we can work together, understand the issues that we're all dealing with, and working on the policies and projects that come out at the national level. They all do different projects as well. They're not exactly the same as AMSANT. They all have different functions depending on their member services needs. That's one of our leadership workshop photos out at Kakadu. As you can see, we have a range of people from younger to older, female, male, and from all across the Northern Territory. So that's just one group in 1 year, and this has been going on since 2006. We've probably only had, apart from me, each participant has either only been once or twice. So we've pretty much had about, how many? 60 odd people come through our leadership workshops already. AMSANT's vision pretty much aligns with what I was talking about with the values and principles of Aboriginal community controlled health. But the most important thing to note is that these are in line with our member services' own values and visions, because that is who we represent and who we work to. So there's our member services all across there. I think the only two that are missing, where Kakadu Health is in the middle up the top, that is now Red Lily Health Board, and in Darwin we have another associate member, which is Ballanu Youth Foundation. So that's a big spread of member services that we try to look after. It's not easy. I mean, ideally I would love to be able to travel around and visit a number of the health services to be able to see how everyone's going and what they need from me. Limited resources make that very difficult, and time as well. So where do GP registrars fit in? So I don't know if it's already been sort of mentioned, but Leanne is one of our workers that works part-time with AMSANT and with NTGPE, who deals with the GP registrar placements. And it's a great initiative that's been going on for a number of years now. The training opportunities are with Aboriginal Community Controlled Health Services, with Danila Dilbur in Darwin, Meerwatch Health Service in Nhulunbuy, Worley in Katherine, Sunrise in Katherine, and Annie and Guinea in Tennant Creek, and Congress in Alice Springs, as well as others. The relationships with Indigenous staff, it's so important within the Aboriginal Community Controlled Health Services. Like I said, for AMSANT, we don't call each other colleagues, we call each other family, and that's the most important value in any sort of health service. There's such a passion and commitment in there, in the health services, that to understand the local community and the people themselves, every community is different, every region is different, and it's so important to have those relationships with the individuals and the community to be able to work together. I suppose these are points that we'd like you to consider when you're going out to work within the Aboriginal health services, within the communities, to think more around the community context. So everywhere you go is going to be different, everyone you're going to meet is going to be different. There will be similar health issues, similar community sort of issues, but it's always important to just go in there fresh-minded and think about who you're working with and why it's so valuable to be able to experience.